This video will focus on post-traumatic headaches and cognitive difficulties. The information has been provided by the Ontario Neurotrauma Foundation's Best Practice Guidelines for Concussions and Mild Traumatic Brain Injuries. Headaches are one of the most common and prevalent symptoms that persist after a concussion or mild traumatic brain injury. The majority of individuals who experience a headache post-injury typically improve within a few days or weeks. However, some individuals may experience headaches for a longer period of time, for several months or years. The International Classification of Headache Disorders includes diagnostic criteria for both acute and persistent post-traumatic headache following an injury. These criteria can be found in Appendices 6.1 and 6.2 linked below this video. The primary care provider should take a focused headache history in order to identify the headache subtype that most closely resembles the patient's symptoms. To aid in determining the specific phenotype of headache disorder present, refer to the ICD-3 beta classification criteria found in Appendix 6.3. It should be noted that some post-traumatic headaches are currently unclassifiable. Primary care providers and healthcare professionals treating patients' headaches should also perform a neurologic and musculoskeletal exam, including cervical spine and vestibular examination. The treatment of headaches should be individualized and tailored to the clinical features and patient preferences. The treatment may include headache education, including topics such as stimulus control, use of caffeine, tobacco, alcohol, and other stimulants, non-pharmacological interventions such as sleep hygiene education, dietary modification, manual therapy and exercise, relaxation and modification of the environment, and pharmacological interventions that are appropriate both for acute pain and prevention of headache attacks. For patients with post-traumatic headaches that are migrainous in nature, the use of migraine-specific abortants, including diclofenac potassium oral solution and triptan class medications, may be used if effective, but should be limited to fewer than 10 days per month due to the risk of developing medication-induced headaches with more frequent use. In addition to the headaches, persistent cognitive symptoms following a concussion or mild traumatic brain injury can affect an individual's ability to function in everyday life. It is important to document cognitive symptoms in order to characterize the nature of these symptoms and to track progress over time. Since certain comorbidities can exacerbate cognitive symptoms, patients should be provided with education highlighting that their cognitive symptoms may be intensified and prolonged by these comorbidities, examples of which include, but are not limited to, pain, fatigue, and sleep disturbance. If cognitive dysfunction does not resolve with treatment of potentially contributing factors, or if cognitive symptoms persist past 3 months, practitioners should consider referral for neuropsychological assessment. The evaluation may assist in clarifying appropriate treatment options based on individual patient characteristics and conditions. Evidence-based neurorehabilitation strategies should be initiated if the individual exhibits persistent cognitive impairments on formal evaluation and/or to facilitate the resumption of functional activities, work, and school. If persistent cognitive deficits are identified by a neuropsychologist or other healthcare professionals, implement temporary work or school accommodations or modifications and provisions for assistance, such as implement schedules, avoid excessive anxiety, pace activities, and other such options. For further information regarding post-traumatic headaches and cognitive difficulties, you can refer to Sections 6 and 9 of the Ontario Neurotrauma Foundation's Guidelines for Concussions and Mild Traumatic Brain Injuries and their persistent symptoms. Special acknowledgements go out to the Kinesiology Department at the University of Waterloo, the Centre for Community, Clinical and Applied Research, and the Ontario Neurotrauma Foundation, which provided the funding for this video.